Hello everyone, Tim here with Tech Muscle. Today I'm going to talk about something for the techs and for the exercise people, the exercise science people, okay? This one is a common cause of low back pain if you have a job where you sit for long hours at a time in a chair. I'm a college student and I have been for going on 3 years, and I do spend a lot of time sitting in a chair. And I am starting to suffer for this, and this is partially why I decided to go ahead and do this video now. It was coming, part of my training in the American Council on Exercise for becoming a personal trainer was to correct muscular imbalances, and this is a muscular imbalance, okay? But if you're suffering from low back pain, from skeletal deformation or skeletal twisting, such as scoliosis, something like that, this likely isn't going to help you. Consult your doctor, deal with that. Of course, always consult your doctor before starting any type of exercise program, even the stretching, okay? So let me explain to you why you're having low back pain when you sit in the chair, or from sitting in the chair for so long. It's going to feel like almost like a pinch on your spine, almost like your spine wants to kind of fold right about, not at the bottom, but up just a little bit, okay? So there's a muscle that attaches there at the spine and runs inside of you, down, and one on each side of the spine, and they go into your leg bone muscles. They attach down there, almost in your groin, not quite, just below your groin, okay, right on the inside of your legs there, okay? So you have a muscle from your spine going to here, okay, right? Okay, you can see as you're sitting in the chair, fairly similar to sitting in my chair, your chair, the muscle is at a certain length. Now, if I were to be standing up, I'm going to lay back to simulate standing up. Look what happens to the muscle. It has to stretch. I can't even get near the inside of my legs now. Okay? And now back, okay? See? You see what I'm saying? So that muscle, you can see it. It has to stretch when you lean back. Same thing when you stand up. That's why people that have stand-up active jobs, they don't suffer from this. The medical term is called Anterior Pelvic Tilt. If you'd like to discuss it with your doctor, they'll know exactly what you're talking about. Tell them, you sit in a chair a lot, I think I'm suffering from anterior pelvic tilt, I have some low back pain. Boom, I almost guarantee they're going to send you to a physical therapist, and this is exactly what they're going to do. They're going to start off probably with this stretch, or this stretch will be involved. Okay, this is to stretch the iliopsoas muscle in itself. And you want to hold any stretch that you're looking to gain flexibility or gain length. You want to hold it for 15 seconds or longer. Any shorter than that, it's beneficial to stretch. May help prevent injury before or during workout or after workout, but isn't going to gain you any more flexibility, okay? There's a good tip for you who do martial arts and specific sports you may want to gain flexibility for. Hold your stretches for more than 15 more seconds to gain flexibility. All right, so this one, I have a chair right here. I just do it to help myself balance. I have a little yoga mat. You can use whatever you want just to help pad your knees, okay? So what you're going to do is you're going to be on one knee, and the other knee you're going to kick back. Make sure you come up high enough this way, and almost like you're on your thigh muscle, just because it's uncomfortable to have your kneecap on the floor, okay? Just a little tip. Okay, we're going to kick this one far back, and then we're going to pull. We're going to lean a little forward, and we're going to almost try and pull that knee across the floor, but not quite, okay? You're going to hold that stretch for 15 seconds. I'm not going to do it for 15 seconds for the sake of the video, and I'm trying to keep this one short, okay? And you're going to switch to the other one. Okay, your knee doesn't have to be 90 degrees here. More of the point is that that one's kicked back, and you're going to get that stretch, okay? Kind of lean forward, keep that knee planted, even if you got to kick it back a little further, and lean forward and stretch. You'll feel that nice stretch. You should be feeling it in a little bit of your stomach, a little bit of your the upper part of your thigh there, okay? Maybe a little in the obliques, depending on how straight you are there. But those two stretches right there, they're going to stretch both of those iliopsoas muscles. Hold them for more than 10 seconds. You're going to start to regain some of that length that you've been losing for sitting for years in a chair, okay? It took mine about 2 years before I started to suffer from, about maybe 2.5. And I started to feel it, and especially when I'm squatting, I throw that bar on the back, I can tell my spine near the bottom is pulled too far forward by that muscle, because the spine it has too much of an arc. It's supposed to have a little arc, has too much of an arc because that muscle's pulling on it, making that back muscle tighter. There's where your low back pain's coming from. And it feels like it just wants to fold. It feels like it wants to snap, and which isn't good. So I can't squat a whole lot right now until I get this adjusted. And that's the first way how you're going to go about adjusting it, because it pulls it forward. Okay, here's your body. All right, I just told you the low back is going to be compressed, so that means that muscle's being compressed a lot too. Not only when you're sitting all the time, because now you're like this, okay? And duly noted, if you have any type of abdominal fat, especially in males, that's not going to help either, because now you have more weight pulling. You have muscle pulling on it, you got some weight pulling on it. It's just, it starts to compound, okay? Your low back starting to get tight too. This is how you're going to stretch the low back. Again, hold it for 15 seconds. Okay, let's scoot up a little for the camera. All right. What you're going to do is you're going to take and you're going to grab your knees and go ahead and lean back all the way to your shoulder blades, and you're going to pull on the knees. Pull on the knees. You can do it, my back popped a little. You can do it one at a time. Okay. Remember, even if you're doing one at a time, hold it for 15 seconds. I'm not doing it just for the sake of the camera, okay? This feels really good though, by the way. This is a nice low back stretch. Especially if you're suffering from this, you're gonna know right about now, this is gonna help you. Because you feel it. It feels a lot better, right? Oh gosh, right there, okay? And another thing, if you do have enough abdominal fat, you're having trouble pulling your knees back, first thing you need to do is work on losing that abdominal fat. I'm gonna make some other videos on fat loss. I've already got a couple as far as cardio and such, or fat burn zone. Okay, here's the other thing, okay? Before I run out of room here on my camera too, plus I wanna keep this short. As you can see with that curvature, that pulling on it right there, not only, okay, so it's making this muscle tight, what's it doing to your abdominal muscle? It's stretching it, yes. And that's holding that stretch all day long. So your abdominals are just gonna continue to stretch, stretch, stretch. Like I said, this is kind of a compound thing. One thing makes another thing react, makes another thing react, and it kind of compounds like a snowball effect, okay? So you have to stretch the iliopsoas, you have to stretch the low back, but on the counter side of the back, you need to tighten the stomach, okay? I'm gonna show you how I do a crunch. This is how we learn them in the US Navy, okay? You're gonna kick your feet up, cross your feet, just your feet, okay? Keep your knees up. Now, what I don't want you to do is grab the back of your head. Never do that with a sit-up or a push-up. This is how they had us do it in the Navy. Boom, and crunch. And you can pull your legs and crunch, crunch, crunch. And do that, I'd say, depending on your fitness level, I don't know, 10, 20, 30, you know, just work your way on up to where you can start to tighten those ab muscles, okay? And don't stretch your abs. That's how you tighten a muscle. Work it and don't stretch it, and it'll become tighter. You ever see a bodybuilder that can hardly move? That's why. All right, that should straighten up the anterior pelvic tilt and take care of that low back pain for anybody that sits in a chair.